Hi, today we are going to talk on diabetes and the oral health. Diabetes mellitus or hyperglycemia is the most common disease in the Indian population in today's era. It's one of the leading dominant disease what we find in the today's population. Also, now we will see how the diabetes affect the oral health or the dental health of the body. When you find the diabetes, it's affect almost start from the toe of the leg up to the hair. So every part of the body we get affected with the diabetes or the raise in the sugar level. So when you think about the oral health, the most common thing the diabetes affect the oral cavity is your immune system. The immune system is get exaggerated or get nullified, or what you call as immune system is compromised when you have a diabetes. So when you have a low immune system, your WBC counts get decreased and your defense mechanism get reduced. So once the defense mechanism of the body is reduced, there will be opportunistic infection in the oral cavity, mainly the white lesions that is called as candidiasis or the fungal infections. So this is the most common thing which we find in the hyperglycemia or diabetic patient, that is the fungal infection called as oral candidiasis. Also some autoimmune diseases also we can find in cases of diabetes patient, that is Leukoplakia or lichen planus. These are the autoimmune diseases which affect the tongue, buccal mucosa and the rest of the oral cavity. The next effect of diabetes or hyperglycemia in the oral cavity is your dental caries. Due to halitosis and xerostomia, because of diabetes, the patient have a reduced saliva in the oral cavity, which leads to halitosis as well as the caries in the teeth. Next point is your about diabetes and oral health is your gum diseases. This is the one of the hallmark, or which called as the key point of the diabetic patient, that is they always have or most of the time they have a gum diseases, mostly the periodontal disease, that is the swelling in the gums, bone loss, and also the abscess formation in the gums. These are the recurrentest chronic disease which occurs in the oral cavity, which is a hallmark for your diabetic. Again, the next most common form of diabetes affect the oral health is your teeth color of the teeth changes, and because of uh, various deposition of calculus and the stains in the oral cavity or the deposition in the gums. And last point about the diabetes and oral health is your various types of opportunistic infections get encountered through the oral cavity in case of diabetes patient. Vice versa, when you have a diabetes, the raise in the infection in the oral cavity can increase the sugar, so it's a vicious cycle. If you have a diabetes, uh, it leads to oral infection, and if when the oral infection increases or oral bacterial colonies increases, it again leads to the increase in the sugar. So this diabetes or this diabetes mellitus forms a sugary bed for the intraoral microorganism present in the oral cavity, which leads to various forms of serious infections in the cavity in the body or in the oral cavity. So now the next point is the most important point, that we have to see that the how to treat the diabetic patient. How, if you have a patient with the diabetic mellitus with the dental issues, how to treat it. It's the most common thing that if you find the hyperglycemia patient, the most common disease we find is the number one is your gum diseases or the periodontal diseases. Number two is the caries. Number three is the white plaque on the teeth. Number four is your candidiasis, or we call it as the fungal infection, and the last point is the halitosis. So we have to encounter all these things with the help of a dental professionals. So always the patient is a diabetic or the patient is having a raised sugar, you always have to consult a dental practitioner and always have a routine follow up for your oral cavity. The most common procedure should be done is the you have to avoid sticky foods and the food which causes increase in the sugar level. Number two, always you have to do a good root planning or the cleaning of your teeth with the help of dental professions. Number three, always you have to keep your oral cavity teeth clean, and always you have to brush your teeth 2 times a day. And last point, in diabetic patient, always you have to maintain your oral health with proper oral hygiene. Thank you very much.